100 patients so far. Can you break down like approximately who would be the critical conditions or who would be the minor injuries? Do you have any approximate breakdowns?
I don't know.
Can you again describe the scene, as you said, this line of ambulances coming, cars coming in and triaging, wherever people could be triaged. Can you describe the scene again?
Sure. So the majority of our patients either came by car or by ambulance to our emergency department, and then most of the ambulances themselves came right to our trauma center. Those patients were triaged just in front of the trauma center to make sure that they were getting the appropriate care. So if they needed a lower level of care or perhaps could be treated in the emergency department, they went to the emergency department. Those who needed to definitely go into the trauma center were sent straight back to the trauma center.
One of the things that most surprised the physicians was the whole engagement of the top and the bottom of the whole physicians. Did you feel that too here in the hospital?
Do I feel that?
Yeah. How can you personally describe that for us?
Well, first of all, I proudly say we have the absolute best trauma surgeons, not just because we're with the Level 1 Trauma Center, but because our outcomes are so good. This is what they train for, it's what they live for, it's what makes their heart beat, and this is really why they do what they do, so that when people are in their time of need, that they can be at the bedside to provide that life-saving care.
There have been other hospitals in the area trying to get Level 1 and they've been blocked, frankly. Does this call for more expansion of Level 1 hospital certifications throughout the valley so they can handle a mass issue like this?
Absolutely not. I think that this situation shows exactly why it's important to have one Level 1 trauma center that is, expert in taking care of these kinds of things, and that expertise isn't diluted throughout the community.
Were most of the patients transported here, are they from gun wounds?
We did have several gunshot wounds, but we also had a variety of other injuries just because people were trying to get out of that crowd.
Behind you, police are stopping every single car. Who's allowed in right now?
Right now, people who are in the medical district area for doctor's appointments, or if we have staff that's coming in or out, we just want to keep away people who are just coming by to look and to make sure that the people who need medical care right now are receiving it.
What about friends and family?
Friends and family, of course, are let in, and we want them to go right to the bedside so they can help comfort their loved ones.
Are any of them speaking about their experience here?
Not so far. All right, thank you all.
All right, that is Marissa Kinniston for us there at the press conference unfolding at UMC. We just want to take a moment real quick and we're going to sort of switch out